because I receive a lot of questions from people, how do I reduce my large pores? And I always get this question, does facials actually result in enlarged pores because of the constant pricking? Every time I go for facial, I just come out inflamed. And I would think, why is it causing this? Is it even good or bad? So what are your thoughts on it? Hi everyone! Welcome back to another episode on Back to Basics. This is Jolene here once again, and today we'll be talking about how to prevent acne and reduce those large pores. So with me, I have Dr. Eve, who is a consultant dermatologist at the Dermatology and Surgery Clinic at Parkway East and Paragon Hospitals, Singapore. So, hi Dr. Eve, thank you so much for joining us today. Maybe you can share with us a little bit more about yourself.
Hi, Jolene, and hi everybody. I'm Dr. Evelyn. I'm a dermatologist in Singapore, and I'm happy to be here today to share with you some tips and tricks on how to manage your acne better.
Yes, I think acne is a very common issue amongst many, teenagers and adults. All of you actually are susceptible to acne, even myself. And today, Dr. Eve will be sharing with us what is acne and also what are some ways we can treat it.
So acne is very common. It's a very common condition that I see, and it is usually common in not just what people think puberty, but also common when in patients who are in their 30s and their 40s. And what happens is that there are several processes that go on when you develop acne. The first step usually starts with clogging of the pores. And when there's clogging of the pores, sometimes there is build-up of oil within the pores. And then with the building up oil in between the pores, sometimes you can get bacterial infection as well as inflammation. And this will contribute eventually to a red, angry, pus-filled bump that you see, which is your zits.
Okay, so that's the red ones that actually swells up. But what about those very small ones that we see? Are those acne as well?
Yeah, those are acne as well. So those are the beginning of acne. So in the beginning of acne, when you just get the clogged pores and the build-up of oil underneath the skin, you don't get the red swelling and the pus, but you do get those black little bumps or sometimes the little white heads that run underneath your skin and make your skin feel a bit rough to touch.
Okay, so you do have the small ones and the red angry ones, but what are some ways we can prevent that?
Okay, so I think since everything is always back to basic skincare, so for the first thing when choosing a cleanser, choose a cleanser that contains ingredients that can help exfoliate the skin gently. For example, such as alpha hydroxy acids or salicylic acid. Look for these in the ingredient list of your cleanser because that will help unclog the pores and prevent build-up of dead skin cells and oil that will clog the pores even further. And then a lot of people think that because they have acne and because they have oily skin, they shouldn't be using moisturizers and sunblock. But actually that's not true. You should still be using moisturizers and sunblock, but basically you just choose a moisturizer that is less greasy and doesn't clog the pores. So look out for the labels. Look out for a label that says non-comedogenic, so that it means that this sunscreen is less greasy and less likely to clog up your pores. And then there's the same thing for sunblock as well. Choose a less greasy formulation, but don't skimp on that because it's important for overall skin health.
Okay, so you mentioned non-comedogenic. What is this about? What's this big word about?
Yeah, so non-comedogenic used to be a label by the cosmetic industry, and they used to test it on rabbit ears to see whether after application of the product, whether there is formation of blackheads and whiteheads after application of the product, and if there isn't, then they call it non-comedogenic. But now they have advanced a bit. They have not used it on rabbit ears now, but they now use the product on human subjects on their upper back for about 14 days just to see whether there's any blockage, comedone formation. But even then, it's not 100%. So doesn't mean that if this product doesn't form blackheads and whiteheads on a patient a volunteer who on the upper back, doesn't mean that it will not form blackheads and whiteheads on you. So cleansing the face is still very important, and choosing the right product is really important.
Right, okay, so that is actually for the face acne, and also you mentioned about pores that results in acne. So now let's talk a little bit more about pores. You know, because I receive a lot of questions from people, how do I reduce my large pores? And I always get this question, does facials actually result in enlarged pores because of the constant pricking? You know, every time I go for facial, I just come out inflamed. And I would think, why is it causing this? Is it even good or bad? So what are your thoughts on it?
Yeah, it's a very common for me as well to get questions about pores. So firstly, we need to understand what's a skin pore. So a skin pore is like a channel in the skin where you know, our body secretes oil and secretes sweat, and what happens is that there are two factors mainly that contribute to enlarged pores. So the first would be the contents of this channel itself. So if the content is of the channel is distended with oil glands and blocked by skin debris, and then that's when you have the appearance of an enlarged pore. And sometimes the oil that's stuck in the pore gets oxidized, and then that's when you get this blackhead appearance because of the oxidation process. The walls of the pores also contribute to the appearance of the pores. So it's not just the content but the walls. So the walls are like the support for the pores. So if with age, unfortunately, when we lose collagen, our pores become a bit more obvious because there's lack of structural support to the pores. In patients who have had a lot of sun exposure in the past, sun exposure can also lead to an expedited rate in which your collagen is degraded, and that can also contribute to large pores as well. And then the last factor, which unfortunately we can't change, is in the genes. So if you look at your parents and if they have pores that are on the larger side, you know, you have a chance of getting larger pores compared to your peers as well.
Right. Oh, okay. But having said that, is there any way we can reduce the size, however minimal it is?
Yeah, so there are a couple of ways, of course, that we can do to reduce the size of pores. So firstly, by reducing the content of the pores. So by washing our face regularly with an AHA or BHA based product that will help exfoliate the pores, and using some off-the-counter or medications to help the skin differentiate normally so that it doesn't get clogged up easily. These are things that can help. Going for facials, as long as it's done properly, also can help expel the content of the pores. And then in terms of protecting the structure of the pores, the walls of the pores, using a good sunscreen to protect against the harmful effect of UV rays. And then sometimes in my practice we would do lasers or even inject low doses of Botox just to strengthen the walls of the pores, as well as to reduce the production of contents that may clog up pores.
Okay, so seems like it's all back to basics, your skincare and also the ingredients that you choose when it comes to caring for your acne and for your pores, because pores eventually lead to acne. Yeah. Okay, so thank you so much, Dr. Eve, for sharing with us today about how to reduce large pores and prevent acne. I hope you have a better insight on how to go about doing that. Share with us your progress in the comments section below, and if you like what you're watching, remember to hit the like and subscribe button. See you again on our next episode, and goodbye!
Bye!